Well, first of all, thank you very much for giving me this opportunity to join you today. And let me very briefly introduce myself as asked. My work on the Charter of Rights for people affected by substance use began back in January 2022 when I was appointed by the then First Minister to build and lead the National Collaborative. Now, this was an idea, the purpose was to support Scotland's shift from what had been a criminal justice approach to a public health and a human rights-based approach. And it was really very much in the context that we're all familiar with of the escalation in drug and alcohol-related deaths, which were declared, certainly as far as drugs was concerned, as a public health crisis. So after I was appointed, I then put out a public call for people to work with me, to help me on this journey. And that led to me recruiting 15 people, all of whom shared a range of different kinds of life experience of substance use. And they formed a change team, which then began with myself to drive this work forward to prepare a Charter of Rights for people affected by substance use. And what then happened was a process of going around the country, listening and learning from people affected by substance use, their experiences, the barriers that they faced in trying to get the sort of support that they needed. And that was then analysed by us, and we then used that evidence to draft a Charter of Rights for people affected by substance use. And we put that out for consultation, going back around all of these individuals and communities that we had met with and asking them if this was what really they thought would be needed. And they broadly supported it, but gave us some room for improvement, which we then very much took on board in finalising the Charter. And we also developed a toolkit to accompany the Charter, i.e. how do you actually put this into practice? How do you use it in everyday life? And we did that using a collaborative process of an interaction, bringing together the change team with a panel of around 15 to 20 decision makers in the design, delivery and monitoring of relevant support services to ensure that the toolkit was something for everyone, for those people who were approaching support services as to what they should be expecting, but also for those decision makers and frontline workers higher up the food chain, those people designing, delivering and monitoring services, what they needed to understand how they could put the Charter into practice. The Charter itself was then launched in December 2024 at an event in Glasgow. It was supported in person on the day by pretty much the whole of the drugs and alcohol sector, also by the First Minister in person, John Swinney, and also in person by a representative from the United Nations who had been tracking our work and welcomed it as the Charter being the first of its kind in the world and a leading national example of good practice in addressing substance use, which is a global problem. So since its launch a year and a half or so ago, the Charter has begun to be used in all kinds of different contexts. Significantly, within the last few weeks, we have seen it embedded in the Scottish Government's new strategic plan on alcohol and drugs. And very encouragingly, it is also going to be supported in its use in everyday life by the Scottish Government's manifesto, election manifesto commitment to bring into Scotland the internationally recognized rights which exist in the UN human rights system, and to bring into our law all of those rights through a Scottish Human Rights Bill, which the government is now committed to introduce to the Scottish Parliament, it now having been re-elected and on that manifesto commitment. So I played a role over the past few years when, again, the then First Minister appointed me um, back in 2019 to become the independent co-chair of the National Task Force for Human Rights Leadership. And this work that was done by that task force has now been paving the way in developing the drafting of the Bill of Rights, the Scottish Human Rights Bill, which is to be introduced, as I say, in the new parliamentary session. So among other things, this bill will put into law the internationally recognized right to the highest attainable standard of physical and mental health. And simply put, the bill will therefore provide the necessary accountability framework for the Charter of Rights. It will underpin the Charter of Rights for people affected by substance use. And therefore, the Charter will not just be a nice to do, but will become a need to do by all bodies in Scotland. So you and Murray, with the work that you have been doing, have put yourself ahead of the curve, and I congratulate you for that. So people affected by substance use understand best what has not been working to date and what changes are needed in the design, the delivery, and the monitoring of support services. And people affected by substance use quite simply have the most at stake. They have their lives at stake. And so it's absolutely critical, and it's at the heart of the Charter, that people with lived and living experience must be at the heart of the design, delivery, and monitoring of all the relevant support services. And from all the work that we did going around the country, listening to and learning from the experiences of people affected by substance use and the barriers that they faced in getting the sort of support that they needed, the key takeaway was the need to shift the power imbalance between those seeking support and those giving the support, and also to change the culture of stigma. And this includes not only stigma towards people affected by substance use, but even more insidiously, self-stigma. People internalizing the stigma and seeing themselves as less deserving than others. And it's that self-stigma which is keeping people away from the support services or accepting services which are not good enough and should be better. And so the contribution of the Charter of Rights is to help change this culture of deserving and undeserving to one of rights holders, of people affected by substance use, not just being victims, but actually having the same rights as everyone else in society has to the highest attainable standard of physical and mental health. And also that those who are making decisions about what kind of support should be given to people affected by substance use should be seeing themselves as duty bearers, recognizing the rights of people affected by substance use and making sure that services are designed and delivered and monitored in a way that enables these rights to be enjoyed by those seeking support. So it's very much one of the need to see people for who they are, and not just to see them, but to see them and their rights, and that these rights must underpin the way in which support services are provided. Now, all of this should be done in a collaborative process, and an example of how this was done was when we developed the toolkit to accompany the Charter of Rights, how you put the Charter into practice. We did this, as I said, through very, very productive collaboration between the change team and this panel of duty bearers in order to ensure that the Charter was something that was there for everyone, both rights holders and duty bearers. So a collaborative process is very much the way forward. Well, my message today to partnerships and communities, and particularly, first of all, to you and Murray, is keep going in the leadership that you're already providing. To further develop the charter tools of the FAIR model, of LLE and ADP engagement, the AAAQ, and of course your own brand new LLE app, which you are launching today, and congratulations on that. And my appeal to you is to keep sharing the valuable experience that you're building in Murray, and the lessons that you have been learning, and to share them with other ADPs and other communities around the country, which I know you have been doing, but the more that you do that, the more the benefits will be shared. And also, whilst you are, in my view, taking a leading role in Murray, you're not alone. There are now ADPs who are taking up the charter, and for example, very encouraging the work that's been done in places like South Lanarkshire, where they have done a kind of gap analysis of where the Charter of Rights is not actually being put into practice in an everyday way. But recognizing whilst they're doing that gap analysis, a sort of self-assessment, that there's a lot of good practice going on, which may not be branded as a human rights-based approach, but actually pretty much is. And so to build upon that and to recognize the good things that are already being done, but then to scale them up and to fill the gaps that have been identified. And to do that not through taking the whole thing on as a oneer, which might be difficult to digest, but more taking bite-sized pieces of work, filling in those gaps and using the Charter to strengthen the efforts that have already been underway. And throughout all of this, being guided at all times by people affected by substance use and by lived and living experience groups in South Lanarkshire. And there are other ADPs that are beginning to follow this path and to follow the lead that you and Murray have been giving. So, in conclusion, my message to you would be the change that you want to see, and keep leading. And thank you very much for the leadership that you have been providing to date. Good luck with everything. Thank you.